Inclusion criteria for the dehydration study is that the patient has to be 1 month to 5 years of age, and make sure to wait 30 minutes if the patient drank or vomited before you do the urine dipstick, and the parent has to be at least 18 years old. The symptoms are vomiting and or diarrhea, and make sure to check with the treating physician and see if they suspect dehydration. Also, you have to make sure that the physician has ordered a urine catch so that you can do the study. And the exclusion criteria is if the patient has any of the listed diseases such as or listed conditions such as appendicitis or recent trauma, or if the patient has any significant chronic disease that affects their hydration, such as kidney diseases or metabolic diseases, or the others listed on the paper.
Okay.
Hi, my name is Diana. I'm a research observer here at CHLA, and I'm approaching you because we have a study called the dehydration study, and it looks as if your physician has your physician told you that your child might possibly have dehydration?
Yeah.
And has your physician also told you about the treatment for dehydration?
Mm-hmm.
Okay, which is to administer IV fluids and then test for dehydration by doing a urine catch?
Oh, yeah.
Okay, so the purpose of the study is to try and find an easier way to test for dehydration rather than doing the urine catch. Now for this study, we have to do both. We have to do both the urine catch, and we're also going to be putting a very, very tiny piece of plastic in your child's mouth for only 3 seconds, just until it gets wet, and then we'll be testing that and comparing it to the urine sample, and then see if the results are the same.
Okay.
And then, so let me go through the consent document with you right now. So as you can see, if you participate in the study, your child will have a urine test, which is typical for dehydration cases. And in addition to the test, we will also test your child's saliva by using that little stick. And then, so if your child, since your child is young, and your child can't, pee straight into a cup, we'll have to insert a very thin tube and then to catch the urine. Is that okay?
Okay.
Okay. So there are no potential risks and discomforts other than those associated just with catching urine. And then, so the benefits listed here to the subject society is to try and find an easier way to diagnose dehydration. And then you will have no financial obligations, you won't have to pay for anything. And all your medical information will be kept confidential and only to the investigator and his team. And then also, if you would like to withdraw at any time, it's completely fine. This study is completely voluntary. And if you wish to obtain more information about the study during or after, you can contact the investigator at this number. And then here is, so if you can sign right here.
Sure, I have a question.
Yes.
So, originally, without doing the study, it would be the same thing, except that now you're just going to put a stick in my baby's mouth?
Yes. So your baby would normally have a urine test, and then now we're just using this little stick for only 3 seconds to try and compare which results are better or if they're the same.
Oh.
Okay. So I can have your signature right here.
Yeah.
Also, so I mentioned before about keeping the information about your child confidential. This is the HIPAA form, the Health Insurance Portability and Accountability Act, which protects your child's medical information. And all you need to do is sign here acknowledging that you have received this. Right here. And then please indicate the relationship. Okay, perfect. Thank you. I'll send you a copy of this.
Thank you.
So after you finish talking to the patient, you want to make 2 copies of these, but remember to fill out your part right here, and then if you have a witness, which you probably should get the signature of the witness. And then since the child is very young, you can say that consent was not obtained for a subject under 18 years of age, and then write that child was an infant or child was too young. And then make 3 copies, one for medical records, one for the patient, and then one for the study. And then, so this paper you just give to the resident to fill out. And then for this packet, you also give it to the resident, but before you do that, just fill out this top part, which is just age, gender, date of birth, stuff you can find on the MRN sticker. And then this is the paper, and then make sure the resident or the attending has filled out all of the questions at the end of the study. This is the urine dipstick case. So just take one out, or give this to the nurse, and then ask them to stick it in the child's mouth for 3 to 5 seconds until it gets wet.